Let's now do some sports. Ghana has been selected as one of the 5 countries to form the first phase of the newly instituted Community Sports and Health Cooperation between the International Olympic Committee and the World Health Organization, with PATH as the implementers. A multi-stakeholder meeting. The president of the Ghana Olympic Committee, Mr. Nunoo Mensah, said mass participation in sports is the solution to healthier living in the country.
Committee, and he will speak to us.
The conference room of the Labadi Beach Hotel in Accra hosted the multi-stakeholder meeting on sports, physical activity and health, with Ghana selected as one of the first 5 countries to form the first phase of the newly constituted Community Sports and Health Cooperation between the International Olympic Committee (IOC) and the World Health Organization (WHO), with PATH as the implementation partners. The meeting attracted key stakeholders in sports and health. The new collaboration between the IOC and PATH is expected to increase access to health-enhancing community sports activities for over 1 million people across 5 countries by the year 2025. The president of the Ghana National Olympic Committee, Mr. Nunoo Mensah, described the meeting as important.
The more we invest in sports, the lower our health budgets get. And I think that what IOC has started through PATH and the WHO, in Ghana, it may seem like we're going to get everybody to be active. But globally, we want a much healthier and a much stronger world.
The Chief Director of the Ministry of Youth and Sports, Mr. William Kate, said the successful implementation of the 13th African Games has opened the way for the reintroduction of the National Sports Festival in August 2024 as a way of letting people get involved in physical activity, which falls within the goals of UN and the International Olympic 365. A representative of the Ghana Health Service, Mr. Isaac Obeng Tando, said the service is worried about the kinds of diseases killing people in recent times due to the lack of physical activities. The current manager of PATH, Dr. Patience Kofi, said actions should be prioritized towards achieving the national physical activity target.
One of the important things we did in the beginning was to work with partners who were also supporting the ministry and the Ghana Health Service to get essential indicators into the data platform so that people will start looking at those indicators and work around.
The Associate Director of Olympism 365, Oli Datfield, called on the government to create more opportunities for people to do physical activities.
And the Chief Director spoke well around the investment and commitment from the government of Ghana to ensure more places for people to be able to participate in sport and physical activity. But if those places are only used by one group in the community, and it may be that we see these places are used only by men and boys, only used by adolescent boys, then we aren't getting that full benefit of those places.
The Director of Research, Statistics and Information Management of the Ministry of Health, Dr. Wisdom Atioto, said if the Community Sports and Health Cooperation Activities project come on stream in Ghana, it will help to reduce at least 15% physical inactivity. It is the hope that the communique will go a long way to achieve the UN Sustainable Development Goals, SDG 3.